Tissue embedding is the process of placing processed tissue into warm liquid paraffin wax. The paraffin wax hardens on cooling to form a solid tissue block. This process is also known as casting or blocking. The aim of the tissue embedding is to provide firm support to the tissue during sectioning, to allow easy cutting of thin tissue section, also to preserve the tissue for long-term or archival use.
Before we start embedding process, we must know the important compartments of tissue embedding center. First, scrape off any excess wax from the embedding center to clean the surface. Next, take out the tissue block from the thermal console. Fill the wax into the mold to a depth of 1/3. Wait until it forms semi-solid. The wax must clean and free from clearing agents and dust. When a thin film of semi-solid wax has formed, tissue is introduced with warm forceps by gently pressing the tissue into the semi-solid wax. Position the tissue in the middle of the mold. Fill the mold with wax until full.
Avoid underfilling the cassette because it can cause unstable clamping and uneven sections.
Place cassette base on top of the mold. Make sure all the cassettes are level. Fill up the wax until the cassette base is immersed with wax. Cool the blocks on the cold plate. Leave for 30 minutes or until cast.
Wait until the cassettes are ready to remove from mold. Make sure to remove excess wax from the outside of the cassettes to ensure firm holding in the microtome.
Proper tissue orientation is important to obtain correct and clear microscopic sections. Different tissues require different orientations depending on their structure. There are a few troubleshooting problems in tissue embedding, such as uneven sections, tissue contamination, epithelium not visible, and tissue falls during cutting.
Besides embedding tissue in paraffin, there are other alternative embedding media that are sometimes used. The embedding medium must fulfill all these criteria to ensure high-quality tissue sections.